Okay, get ready to dive deep because we're talking all about broken bones today, fracture management to be precise.
And I've got a feeling,
You've given us quite the stack of source material on this one, so.
yeah, we're going to try to get through it all, hopefully.
Well, by the end of this deep dive, you'll be quite the expert, I think.
Well, not quite a doctor, but closer. A little bit closer.
Exactly, I love that. All right. So our sources start by outlining the main goals of fracture management, and it's not just about, piecing the bone back together. There's a lot more to it. We're talking restoring function, making sure it looks good cosmetically, and doing it all as quickly as possible. That's a pretty tall order, right?
It is, and it's amazing how the body does this. The source material mentions something called reduction, and this is basically, it sounds simple, but it's really not.
Yeah, they break reduction down into closed and open reduction. I'm already getting nervous just hearing the words open reduction.
Yeah.
So closed reduction, is that more like, setting the bone kind of with your hands from the outside?
Yeah, it's a gentler approach.
Yeah.
Like, think about a puzzle, and you're trying to put the pieces back together. And you're kind of like just nudging them from the outside.
Yeah.
Open reduction is when you have to like open the box, you have to go in surgically.
Okay, got it. So if it's a really, really bad break, shattered into a million pieces, that's when open reduction would be necessary.
Yeah, multiple pieces, or if there's soft tissues that are caught in between. And sometimes the bone, you need some extra support to heal correctly. And that's when they use like plates and screws and things like that.
Oh, okay. Internal fixation.
Yes, exactly. And especially important if it's involving a joint surface, because you really want to make sure that heals well for, long-term mobility.
Absolutely. You don't want to have like a wonky ankle or something for the rest of your life. Okay, so we've got the bone back in place now. Let's talk about how we keep it there. And that's where immobilization comes in. Casts, slings, all that fun stuff. What's the thought process behind choosing the right kind of immobilization?
Well, you kind of hit it on the head, which is what are you trying to prevent from moving? What are the forces? What muscles could pull things out of alignment? So there are a few techniques, and they all have their pros and cons, just like anything in medicine.
Makes sense. Let's start with the most, basic, common one.
Yeah, the classic cast. Yeah, the external non-invasive immobilization. That's the technical term for it. It's the most common for a reason. It's cost-effective, it's durable, and it does a great job, especially for these less complicated fractures.
So plaster, fiberglass, all those fall under the umbrella of external non-invasive immobilization. Okay, interesting. So what about if we're thinking about muscles pulling things out of place? Is that where we get into things like traction?
Yeah, you're right. And we always think about like the old movies where they have somebody's leg is strung up, and
Yeah.
but a lot of times it's weights and pulleys, and it allows for close monitoring, especially if there's a lot of swelling around the fracture.
So they're constantly adjusting it, making sure the alignment's good.
Closely monitoring those soft tissues.
Got it. Okay, so we've got casts, we've got traction. What about those more complicated fractures where, it's not just keeping it still, it needs a bit more support?
Internal fixation is where we bring in the hardware. I always tell patients it's kind of like building a little city in there.
I was going to say, it's like a little construction zone with plates and screws and
rods, sometimes wires, depending on the fracture.
Wow.
So it provides that, higher level of stability, especially, we talked about fractures near joints and things. And so that precise alignment is super important.
Yeah, if it's a joint, you want to make sure that, you've got full mobility after it heals. Okay, that makes a lot of sense. Our source material also mentions external skeletal fixation. That sounds intense. What is that all about?
So imagine almost like a scaffolding around the bone. So they'll actually put pins through the skin into the bone, and then there's an external frame.
Wow.
It's used if there's a large open wound or if there's significant bone loss. And it allows, again, for that soft tissue to heal properly.
It's amazing how each technique is so specific to the type of fracture.
The human body is amazing, but sometimes it needs a little help to get back on track. And speaking of getting back on track, that brings us to the healing process itself.
All right, so we've talked about putting those bony puzzles back together, keeping them stable, of all sorts of interesting techniques. But what's actually happening inside the body as a bone heals? I'm ready for like the microscopic level here.
Oh, get ready to be amazed, because it is remarkable what the body can do. Our sources break down bone healing into this 3-stage process. Pretty fascinating.
Okay, walk me through it. What's stage 1?
So you break a bone,
Right.
right? and it's like an alarm goes off inside your body.
Oh,
Blood rushes to the area. But it's not just, oh, we've got to stop the bleeding. This blood is carrying like a specialized team.
yeah.
White blood cells, platelets, growth factors. It's incredible. This is what we call the inflammatory phase.
So inflammation, which we often think of as a bad thing, is actually really important here.
It's crucial. It's the body's way of saying, hey, we've got some damage here, got to clean up, got to bring in the A-team to start the repairs.
So that inflammatory phase kind of sets the stage for everything else.
Exactly. And what happens next is, I think you'll appreciate this, callus formation.
Okay. Callus, like when I get a blister on my hand and it gets all hard.
Similar concept, but instead of toughened skin, we're talking about a special type of bone that forms around the fracture site.
Oh, wow.
It's almost like a soft bridge, a cartilaginous bridge that starts to connect those broken ends.
So the body like creates its own internal cast, kind of?
Exactly. It's incredible, isn't
That
it?
is wild. But then how does that soft callus, how does that become, strong, hard bone?
This is where those microscopic construction workers you mentioned earlier really come into play. Over time, these specialized cells called osteoblasts, they migrate to the area, and their job is to deposit minerals. They're like little bricklayers,
Oh, wow.
laying down calcium, phosphate. And that gradually transforms that soft callus into hard, solid bone.
That's amazing. The body is so smart. It's literally like rebuilding itself from the inside out.
It really is.
Our sources mention something called remodeling too. Is that part of this process?
Yeah, so you've got, the callus formation, but it's still kind of a rough draft at that point.
Okay.
Remodeling is where things get refined. It's like, sending in the more specialized team to make sure everything is perfect, perfectly aligned,
Yeah.
able to withstand the stress that it's going to be under, make sure it's going to function at its best.
So it's not just about, just bridging the gap. It's about making sure that that bone is going to be just as strong, if not stronger than it was before.
Exactly. And this remodeling phase, this can last for months, even years after the initial fracture.
Oh, wow. Okay. So this whole process, inflammation, callus formation, remodeling, how long is it, like, on average, how long are we talking about here? Weeks? Months?
It really depends on a lot of factors. Think about it. A child's bone is going to heal much faster than an adult bone.
Oh, for sure. Yeah. Like when you're a kid, you break your arm and you're back to playing in like what feels like a week.
It's amazing how resilient kids are. They have these things called growth plates.
Right.
And those growth plates are areas of active bone growth.
Mm-hmm.
So they've got those osteoblast cells, those little construction workers, working overtime.
Like they're on double shifts or something.
Exactly.
Yeah.
So age is a factor. The type of fracture, of course, is a factor. A simple hairline fracture is going to heal much quicker than our source mentioned, a comminuted fracture, where it's broken into multiple pieces.
Yeah, comminuted fracture, that just sounds bad.
Yeah, that's a much more complicated healing process.
Makes sense.
And even the location of the fracture can impact healing time. Bones with a good blood supply, arms and legs, they tend to heal a little faster than those with a less robust blood supply.
Interesting. It's like all these little factors play a role. So fascinating how the body works. But I have to ask, we've been talking about how amazing the body is at healing, but I mean, things don't always go perfectly to plan, right? What happens when bone healing hits a snag?
Right. Well, our sources point out a few potential complications, and one is delayed union or non-union.
So the bone just decides it doesn't want to heal.
Well, not exactly. Sometimes the healing process, it just slows down, or in some cases, it stalls completely.
And what causes that to happen?
Lots of things can contribute. Sometimes it's a blood supply issue. Like we said, those osteoblasts need a steady supply of nutrients to do their job. Other times, it could be an infection.
Oh, right, especially with open fractures where there's that break in the skin.
Exactly. Bacteria, they love to set up shop in places where the body's defenses are already down.
That's a good way to put it. So I imagine infection control is a big part of fracture management, especially with those more serious breaks.
Absolutely, and that goes for all types of fractures, not just open ones. Even with a closed fracture, bacteria can still find their way in through the bloodstream.
Yikes. That's good to know. So it sounds like keeping a close eye on things, making sure there are no signs of infection, that's key.
Absolutely. Early detection is key. And another thing to be aware of, this is another complication that can arise, is vascular compromise.
Vascular compromise, that sounds serious.
It can be. Basically, it means that the blood supply to the injured area has been compromised in some way.
Oh, so it's like cutting off the supply line to those construction worker cells we were talking about.
Exactly. And remember, Blood carries oxygen and all those vital nutrients that are essential for healing. If the blood supply is compromised, the healing process can be significantly slowed down or even come to a halt.
And that can happen even with a simple fracture.
It can. Sometimes it's due to the injury itself, like if a blood vessel is damaged at the time of the break. Other times it can be caused by swelling after the injury.
So the swelling itself can cut off the blood supply.
Exactly. It's like, imagine a kink in a hose. That's essentially what's happening to the blood vessels when there's a lot of swelling.
That makes a lot of sense. So I'm guessing that's why, they always tell you to watch out for certain signs after you get a cast. Like if your fingers start to tingle or turn blue, that's a sign that something's wrong.
Absolutely. Numbness, tingling, discoloration, those are all red flags.
Yeah.
It's your body's way of saying, hey, pay attention. Something's not right down here. And speaking of things not being right, one of the sources mentioned something called Volkmann's ischemia. Have you heard of that?
I have, and it sounds terrifying, like something you don't want to get.
It's definitely a serious condition, but thankfully, quite rare. It's a type of compartment syndrome, and it usually happens in the forearm or lower leg.
Okay, break that down for me. What is compartment syndrome, and how does it relate to a broken bone?
So our muscles are surrounded by these tough, fibrous bands of tissue called fascia. Think of them like compartments. And when there's swelling inside one of these compartments, the pressure can build up. Now, in compartment syndrome, the pressure gets so high that it starts to compress the blood vessels and nerves within that compartment.
And that's when things get dangerous.
Yeah, exactly. Because if that pressure isn't relieved, it can actually cut off blood flow to the muscles and nerves, causing serious damage.
And that damage can be permanent.
It can be if it's not caught and treated early enough. So that's why it's so important to be aware of the signs and symptoms of compartment syndrome, which can include things like severe pain, numbness, tingling, weakness, and even a change in the color of the skin.
Wow, okay, so compartment syndrome is definitely something you want to avoid. It sounds like early detection is crucial.
Absolutely. And this is where, having a good doctor who's really on top of things can make all the difference.
It's like a reminder that even though our bodies are incredible at healing, sometimes they need a little help along the way.
Exactly.
Yeah.
Speaking of things not going exactly according to plan, there's one more potential complication our sources highlight that I think we should touch on. Malunion.
Malunion. Is that just a fancy way of saying the bone healed wrong?
You could say that. It basically means that the bone has healed, but it hasn't healed straight.
So instead of being nice and straight, the bone might be healed at an angle or maybe with some kind of twist?
Exactly. Our sources mention different types of malunion, like angulation, where it heals at an angle, translation, where the two pieces of bone are kind of shifted sideways.
So not lined up properly?
Right, or shortening, where the bone actually heals shorter than it should be.
And those malunions, even if they're slight, they can cause problems down the line, right?
Exactly. Even a minor misalignment can affect how a joint moves, range of motion, how much you can move it, and it can even lead to pain and arthritis later in life.
Wow, we've covered so much ground here. It's amazing how much can go right and potentially wrong when a bone heals.
It's a testament to how complex and amazing our bodies are, wouldn't you say?
So much can go right and potentially wrong when it comes to bone healing, but our bodies are really incredible for healing the way they do.
They really are. And the exciting thing is the field of fracture management is always evolving.
Oh, really? What's on the horizon for treating these kinds of injuries?
Well, we've been talking about these amazing things our bodies do naturally, but researchers are looking into ways to, assist that process even further.
Okay, like what?
Well, one area that's really showing promise is stem cell therapy.
Stem cells for broken bones. That sounds like something out of like a sci-fi movie.
I know, right? But it's an area of active research, and the possibilities are pretty incredible. We could potentially use stem cells to speed up healing, regrow lost bone tissue, even prevent some of those complications we talked about earlier.
Wow. So instead of just, setting the bone and waiting, we could be giving the body this extra boost.
Exactly. It's like giving those osteoblasts we talked about, those construction workers, a whole new set of tools.
That's amazing. Are there any other futuristic sounding advancements in the works?
Well, 3D printing is another area where we're seeing some really cool developments.
3D printing bones, is that even possible?
It is. They're actually using 3D printing to create custom implants and scaffolds that are perfectly tailored to the patient's anatomy.
Wow. So you could have a bone graft that's essentially made just for you.
Exactly. Imagine a bone graft that fits your skeletal structure perfectly. It would promote faster, more effective healing. It's like personalized medicine for broken bones.
That's incredible. So what I'm hearing is that the future of fracture management is all about working with the body, not just trying to fix it from the outside in.
Absolutely. And I think that's what's so exciting about this field. There's so much more to discover, and the possibilities for improving patient care are really endless.
Well, this has been a fascinating deep dive, to say the least. I'll never look at a broken bone the same way again.
I hope not. It's easy to take our bones for granted, but they're pretty amazing structures, and the way they heal and regenerate is nothing short of incredible.
It really is. Well, I think that about wraps it up for our deep dive into the world of fracture management. Thanks for joining us for all the bone-chilling details.
Always a pleasure.
And remember, this is just a taste of what's out there. If you're hungry for more, there's a whole world of fascinating research to explore. So until next time, stay curious and take good care of those bones.